Welcome to this custom-tailored deep dive. We are exploring a really fascinating landscape today.
We really are.
Yeah, looking at this very specific intersection of global pharmacology, regulatory frameworks, and honestly, patient behavior.
Which is always the unpredictable variable.
Exactly. And the foundational platform making this entire analysis possible today is iMedix.
Right.
For context, if you aren't familiar, iMedix operates as an independent medical information platform. It basically functions as this massive, comprehensive drug database.
Right. It pulls together patient safety resources, heavily researched educational content.
All of it.
Mm.
And the main objective of the platform is to bridge that huge gap between, clinical data and the actual reality of how patients consume and interact with their medications on a daily basis.
Because that gap is where the danger lies. The utility of an independent database like iMedix becomes really apparent when you consider the sheer volume of pharmaceutical data patients are expected to navigate.
It's overwhelming.
It is. Healthcare systems frequently operate in these silos, right? Patients are often just handed a prescription with minimal context.
Maybe a tiny leaflet they throw away.
Exactly. They get almost no context regarding the underlying pharmacology or the broader market realities of the specific drug they're taking.
Which is wild when you think about it.
So a platform that aggregates safety profiles, off-label applications, and real-world user interactions, it provides a necessary layer of transparency.
A crucial layer. And our specific focus for this deep dive is a granular analysis of one particular entry in the iMedix database. We are looking at Eriacta 100 milligram.
Yes.
We are going to completely deconstruct the profile of this medication. We want to shortcut your way to being totally well-informed about the complex ecosystem of generic formulations.
The critical safety warnings.
Right, the warnings embedded in its pharmacological profile and the realities of patient administration. Because Eriacta is categorized as a generic version of Viagra.
The active ingredient being sildenafil citrate.
Right. And its primary clinical indication is for the treatment of erectile dysfunction, or ED. So on paper, it belongs to a highly recognizable class of medication. I mean, everyone knows the name Viagra.
They do.
But the database immediately complicates that straightforward narrative. Okay, let's unpack this.
What's fascinating here is the regulatory classification. The iMedix database explicitly flags Eriacta as a not approved drug.
Which sounds alarming right off the bat.
It is a critical distinction to make.
Yeah.
While sildenafil citrate itself, the compound is widely studied and approved in various formulations.
The brand names we all know.
Right. But the specific generic iteration manufactured under the name Eriacta, in this case, by Ranbaxy Laboratories Ltd., it sits in this weird regulatory gray area.
Meaning it's out there, but not officially sanctioned.
Exactly. It is widely available on international markets and heavily through online vendors, but it lacks the official FDA-approved status of its domestic counterparts.
So it's basically unverified.
Yes, and this immediately introduces massive variables regarding quality control, supply chain integrity, and patient responsibility that we really need to examine closely today.
Because whether you're researching this for your own personal knowledge, professional curiosity, or you're just trying to navigate the often super confusing world of online pharmacies, that not approved designation changes everything.
It changes the entire framework of how a patient should approach the drug.
Right, because if you are interacting with the, let's call it the shadowy end of online pharmacies or sourcing internationally,
the responsibility for verifying efficacy and safety shifts entirely onto the consumer.
it's all on you. And to navigate that risk, we need to strip this medication down to its biological mechanics.
We have to look at the blueprint.
Exactly. The text classifies sildenafil citrate as a PDE5 inhibitor. And to understand the severe safety warnings later in the database, we really must first establish the exact physiological cascade that this inhibitor triggers in the human body.
Right. We can look at the mechanism of action as a highly specific manipulation of a localized hydraulic system.
Okay, a hydraulic system. I like that analogy.
It helps visualize it. So during sexual stimulation, the local vascular endothelium...
That's the inner lining of the blood vessels, right?
Correct. The endothelium in the penile tissue releases nitric oxide.
Nitric oxide, okay.
And this nitric oxide acts as a signal. It stimulates an enzyme that produces cyclic guanosine monophosphate.
That is a mouthful.
We usually just call it CGMP.
Let's stick with CGMP.
Good plan. It is the CGMP that is directly responsible for relaxing the smooth muscle cells lining those blood vessels.
So the nitric oxide says go, and the CGMP actually does the work of relaxing the muscles.
Precisely. And when those smooth muscles relax, the blood vessels dilate profoundly. They open up wide, allowing a rapid influx of blood into the spongy tissue, the corpora cavernosa, which results in an erection.
So the body basically initiates a chemical cascade to open the vascular floodgates.
Exactly.
But where does the PDE5 enzyme fit into that whole process? Because the drug is a PDE5 inhibitor.
Right. Phosphodiesterase type 5, or PDE5, is the body's natural regulatory mechanism for this exact process. It is an enzyme found in very high concentrations in this specific tissue.
Okay.
And its entire physiological purpose is to degrade the cGMP.
To break it down.
Yes. It breaks down the chemical messenger that is keeping the smooth muscles relaxed.
Oh, I see.
As the cGMP is degraded and cleared out by PDE5, the smooth muscles contract again, the blood vessels constrict, and the accumulated blood is forced out.
Returning the system to a flaccid state.
Exactly.
So the PDE5 is essentially the metabolic off switch. It ensures the vascular dilation is only temporary.
That's the perfect way to phrase it. And so sildenafil citrate operates by binding to the active site of the PDE5 enzyme.
It blocks the off switch.
It effectively neutralizes it. By inhibiting the action of PDE5, the drug prevents the breakdown of cGMP.
So the cGMP just stays there.
Right. The levels of cGMP remain artificially elevated, the smooth muscle remains relaxed, and the vascular dilation is sustained.
That is fascinating. But it's important to clarify, and the iMedix text emphasizes this. The medication does not spontaneously create an erection out of thin air.
No, absolutely not. It requires the initial release of nitric oxide triggered by sexual stimulation.
It just stops the body from turning the process off once it starts.
Exactly. It simply blocks the exit pathway.
That biochemical distinction is huge. It completely aligns with a crucial point from the text. Eriacta is a symptomatic treatment. It is not a curative intervention.
Right. It's a temporary mechanical assist.
Because it targets the downstream degradation of cGMP, rather than addressing any of the upstream causes of vascular insufficiency.
Things like atherosclerosis, neurological damage from diabetes.
Or even psychological barriers. It doesn't fix any of that. Its efficacy is strictly limited to the pharmacokinetic window during which the drug is actively circulating in your bloodstream.
Once the drug is metabolized by your liver and cleared from your system, your physiological baseline returns to its exact previous state.
It's a boost for confidence and performance, but not a permanent physical fix.
And the source material uses this mechanical reality to dispel several really common assumptions and myths.
Right, let's get into those.
The database explicitly notes there is no clinical evidence of physical addiction or chemical dependency.
Which people worry about a lot with lifestyle drugs.
Naturally. But because it only transiently inhibits a specific peripheral enzyme, it's working in the blood vessels, not the brain, it does not alter neurochemistry in a way that induces physical withdrawal.
Your brain doesn't get hooked on it.
No. Furthermore, the text clarifies that sildenafil citrate does not impact sperm morphology, motility, or overall male fertility.
That's another big myth.
Huge myth. But again, understanding the blueprint explains why it's a myth. It is a vascular manipulator. It is completely divorced from hormonal regulation or spermatogenesis.
It's just plumbing, not the factory.
Exactly. Just plumbing.
Here's where it gets really interesting, though. If the mechanism is purely vascular manipulation, just relaxing blood vessels, that perfectly explains the drug's most prominent off-label application listed in the profile.
The pulmonary hypertension application?
Yes. The iMedix text details that sildenafil citrate is actually utilized for the treatment of pulmonary arterial hypertension, or PAH.
Which is a very serious condition.
It involves dangerously elevated blood pressure within the pulmonary arteries. Basically, it forces the right side of your heart to work exponentially harder just to pump blood through your lungs.
And the application of sildenafil for PAH is a perfect illustration of how localized targeted therapy can have profound systemic applications.
How so?
Well, the PDE5 enzyme we keep talking about, it isn't exclusively located in the penile tissue. It is also present in high concentrations in the smooth muscle lining the pulmonary vasculature.
Blood vessels in the lungs.
Yes. So by inhibiting PDE5 in the lungs, the drug facilitates the relaxation of the pulmonary arteries. It increases their diameter and significantly reduces the resistance the heart must pump against.
It opens up the pipes so the pump doesn't have to work as hard.
Exactly.
So a drug culturally synonymous with men's sexual performance is, structurally and fundamentally, a potent cardiovascular medication.
Yes. And understanding that duality is vital.
I think it's the absolute linchpin for understanding every single subsequent warning in the iMedix database.
It really is.
When a patient takes Eriacta, they aren't just taking an ED pill. They are introducing a systemic vasodilator into their bloodstream.
And that context completely reframes the administration protocols.
Right. It's not a toy. It's a heart medication. Let's shift gears and look at the actual instruction manual.
Yeah.
The dosage parameters detailed in the text are incredibly specific.
The administration protocols are rigidly defined precisely because of this systemic cardiovascular impact,
The database outlines a standard starting dose of 50 milligrams.
which a physician can titrate or adjust down to 25 milligrams for sensitive populations.
Or up to a maximum of 100 milligrams based on efficacy and how well the patient tolerates it.
Right. And the timing requires the dose to be taken orally with a full glass of water,
About 30 to 60 minutes prior to anticipated sexual activity.
yielding a therapeutic window of roughly 4 to 6 hours.
Okay, so that 4 to 6 hour window is key.
Yeah.
But embedded within those guidelines is a very strict limitation, a maximum of 1 tablet per 24-hour period.
That's a hard limit.
But if the therapeutic window, the time it actually works for ED, is only 4 to 6 hours, what is the pharmacological rationale for restricting the next dose for another 18 hours? Why can't you just take another one when it wears off?
The restriction is entirely based on the drug's half-life and the concept of toxic accumulation.
Toxic accumulation.
Yes, while the clinical efficacy, the noticeable effect the patient wants, may wane after 4 to 6 hours, the actual sildenafil molecules are still actively circulating in the blood.
They don't just magically disappear at the 6-hour mark.
No, they are still being slowly metabolized by the liver. The terminal half-life is typically around 4 hours.
Meaning it takes 4 hours for the concentration in your blood to drop by half.
Exactly. And subsequent 4-hour half-lives are required to clear the rest of it. So if a patient takes a second dose before the first has been adequately cleared,
They're stacking the doses.
they stack the peak plasma concentrations.
Because the baseline concentration hasn't returned to 0 yet.
Exactly. So that second pill pushes the total systemic volume way up, potentially into a toxic threshold.
Which sounds incredibly dangerous.
It is. Pushing past the maximum recommended threshold doesn't enhance the intended localized effect. Taking more doesn't make it work better.
Because the local receptors in the target area are probably already saturated.
Exactly. They can only handle so much. Instead, the excess drug amplifies the systemic vasodilation. It forces a dangerous drop in your overall blood pressure and severely stresses the cardiovascular system.
You're just widening all the blood vessels in your entire body at that point.
Right.
And this saturation concept completely addresses the database's specific instruction regarding missed doses.
Oh, the missed dose warning, yes.
The text explicitly warns against doubling up to compensate for a forgotten pill.
Which makes sense when you understand it's not a maintenance drug.
Exactly. Because the medication is prescribed strictly as needed. It's not a daily maintenance therapy designed to keep a steady level in your blood like a cholesterol med or something.
Right.
So the concept of a missed dose is effectively irrelevant. You take it when required, and if you forget, you just take the standard dose when you remember, assuming you still need it.
Taking a double dose of an on-demand vasodilator is a critical error in understanding the drug's pharmacokinetic profile.
You are attempting to manage a temporary vascular event. You aren't trying to cure a chronic deficiency.
The goal is always the minimum effective dose required to achieve the desired mechanical outcome. It's never about achieving the highest possible concentration in your blood.
Okay, so dosage timing is critical. But beyond frequency, the iMedix profile details these really complex dietary interactions that dictate how the drug is absorbed.
The dietary curveball.
Yeah, the curveballs.
Yeah.
The first major interaction noted is the consumption of a high-fat meal prior to taking the medication.
This is a classic issue.
The text states that a heavy meal, like a big steak dinner, significantly delays the absorption and slows the onset of action.
It does.
What are the actual mechanical logistics occurring in the gastrointestinal tract that cause this massive delay?
The delay is a textbook pharmacokinetic interaction governed by gastric emptying rates.
Gastric emptying. How fast the stomach empties.
Exactly. When you ingest a standard oral tablet, it has to travel down the esophagus, dissolve in the highly acidic environment of your stomach,
Okay.
and then it must pass through the pyloric sphincter into the duodenum, which is the very first section of the small intestine.
Right, because the small intestine is where the magic happens.
Yes. With its massive surface area and all those microvilli, the small intestine is where the vast majority of systemic drug absorption actually occurs.
So the stomach is essentially just a holding and dissolution chamber. It preps the pill, but it doesn't really absorb it.
Correct. When the stomach is relatively empty, a dissolved drug can pass into the small intestine rapidly.
Hence the 30 to 60-minute window.
Right. However, the introduction of a high-fat, heavy meal fundamentally alters this entire process. Fats are complex molecules. They require significant time and enzymatic action to digest.
Not heavy duty.
They are. The presence of dense lipids signals the stomach to drastically slow its emptying rate to allow for adequate breakdown.
It closes the gates so it can work on the fats.
Exactly.
So if the patient takes the Eriacta tablet alongside that heavy steak dinner, the dissolved drug is just trapped in the stomach acid along with all those digesting lipids.
It becomes physically sequestered in the gastric environment.
It's stuck in traffic.
It is, because it cannot reach the absorptive surface of the duodenum. Its entry into your systemic circulation is completely bottlenecked.
Meaning that anticipated 30 to 60-minute onset window becomes entirely unpredictable.
The absorption curve flattens out entirely. It means it takes much longer to reach the peak plasma concentration required for any clinical efficacy.
So a patient might assume the drug is fake or that it has failed.
When in reality, the pharmacokinetic timeline has just been severely stretched out by the presence of dietary fat.
Imagine carefully planning the timing of your evening, only to have it completely derailed by a fatty steak dinner. It really highlights how everyday habits intersect with complex pharmacology.
It's a very common practical error.
But that interaction just dictates the timing of the drug. The database highlights a secondary dietary interaction that is significantly more dangerous.
Grapefruit.
Yes, the absolute danger of grapefruit or grapefruit juice. The text warns that grapefruit actively inhibits the specific enzyme responsible for breaking down sildenafil, which leads to toxic accumulation in the blood.
The grapefruit interaction is a fascinating study in hepatic metabolism, liver metabolism.
Break it down for us.
Okay, when a drug is finally absorbed through the intestinal wall, it doesn't go straight to the rest of the body.
It doesn't just hit the bloodstream and go everywhere.
No, it enters the portal vein, which carries it directly to the liver. This is known as first-pass metabolism.
The liver gets first dibs.
The liver utilizes a massive family of enzymes called the cytochrome P450 system. Their job is to identify, alter, and degrade foreign compounds so the body can excrete them safely.
So the body is actively trying to destroy the medication from the absolute moment it enters the system.
Exactly. It recognizes it as a foreign chemical. And sildenafil is primarily metabolized by a very specific enzyme within that system called CYP3A4.
CYP3A4.
Yes. This enzyme acts as the metabolic clearinghouse for a massive percentage of prescription medications.
So where does the grapefruit come in?
Grapefruit and grapefruit juice contain organic compounds called furanocoumarins.
Furanocoumarins.
Right. And these specific compounds are potent, irreversible inhibitors of the CYP3A4 enzyme. Not just in the liver, actually, but also in the mucosal lining of the small intestine itself.
Wait, irreversible inhibitors, meaning if the furanocoumarins bind to the CYP3A4 enzymes, they are completely disabling the body's primary mechanism for dismantling the sildenafil molecules.
Exactly. The drug enters the system, but the exit door is locked.
Wow.
Because the enzyme is inhibited, a much higher percentage of the sildenafil survives that first-pass metabolism and enters the systemic circulation.
It sneezed past the liver's security guards.
It does. And furthermore, the circulating drug isn't being cleared at the normal rate over time. The plasma concentration spikes well beyond the intended therapeutic window.
So a patient who consumes just a single standard 50-milligram tablet but takes it alongside a morning glass of grapefruit juice,
they might experience the systemic exposure of a much higher, potentially toxic dose.
that is terrifying. And that inadvertent overdose forces us to examine the side effect profile documented in the iMedix database. Because this connects the toxic buildup directly to the potential side effects the body might experience.
Right.
If the drug accumulates to toxic levels, or honestly, even if it operates exactly as intended at a standard dose, the systemic nature of the vasodilation guarantees a ripple effect across the body's tissues.
It's unavoidable.
The text outlines the common expected side effects. It lists headaches, flushing like redness in the face or chest indigestion, nasal congestion, and myalgia, which are muscle aches.
If we connect this to the bigger picture, almost all of these common side effects are direct physiological consequences of the drug doing exactly what it's supposed to do, vasodilation.
Right, widening the blood vessels,
Yeah.
but it's doing it everywhere.
Exactly. The sildenafil is circulating systemically, inhibiting PDE5 wherever it encounters it.
Not just in the target area.
Right. While the concentration of PDE5 is highest in the target tissues and the pulmonary arteries, It is present in varying degrees throughout the vascular smooth muscle everywhere.
So the drug is forcing vasodilation across the entire circulatory map.
And the side effects map perfectly to the anatomy of the vascular system. Take the headache, for example.
It's not a neurological headache.
No, it is a vascular event. The blood vessels in the cranium dilate. This increases the volume of blood and the subsequent vascular pressure within the confined space of the skull.
So your head actually feels full of pressure.
Exactly. And the flushing, characterized by heat and redness in the face or chest. That's the visible result of the superficial capillaries in the skin expanding and engorging with arterial blood.
Which makes sense. More blood near the surface equals redness and heat.
Right.
And the nasal congestion follows the exact same logic, doesn't it?
Yeah.
It isn't an immune response or an allergy.
Not at all. The dense network of blood vessels in your nasal mucosa swells up, which physically obstructs the airway.
You get a stuffy nose just from the swollen vessels.
Exactly. And the indigestion, or dyspepsia, is often linked to the relaxation of the lower esophageal sphincter, which allows gastric acid to reflux.
Because the sphincter is a smooth muscle.
Yes. So these symptoms are essentially the collateral damage of systemic vasodilation.
They prove the drug is actively manipulating the circulatory system.
Exactly.
But look, the common side effects are uncomfortable, sure, but they're generally manageable. However, the iMedix database pivots sharply to list severe adverse reactions.
The emergencies.
Yes, reactions that require immediate emergency medical intervention. And the first major warning is experiencing chest pain during sexual activity.
Which is an ominous indicator.
Given our analysis of this as a fundamental cardiovascular medication, chest pain seems like a massive red flag that there is a systemic failure to compensate for the altered blood flow.
It is. The cardiovascular dynamics of sexual activity are already very demanding. Your heart rate, blood pressure, and myocardial oxygen demand all increase significantly.
It's a workout.
It is. So if a patient introduces a systemic vasodilator into that high-demand scenario, they are forcing the heart to work harder while simultaneously altering the peripheral resistance it's trying to pump against.
Right, because if the peripheral blood vessels are dilated, your overall blood pressure drops.
Meaning the heart has to beat faster and harder to maintain adequate perfusion to your vital organs.
It has to speed up to keep the pressure up.
Exactly. And if the patient has underlying cardiovascular disease,
Like compromised coronary arteries.
yes, arteries that are already struggling to deliver oxygen to the heart muscle, that sudden increase in demand coupled with the altered systemic pressure can lead to severe ischemia.
Ischemia meaning a lack of blood supply.
Yes, the heart muscle becomes starved of oxygen, manifesting as acute angina or chest pain.
It is the literal warning sign of an impending myocardial infarction, a heart attack.
It is an absolute medical emergency.
The text also flags sudden alterations in sensory perception as severe medical emergencies. It warns of sudden visual disturbances, including blurriness or even complete loss of vision, and it specifically mentions changes in color vision, often a blue tinge.
The blue tinge is very specific.
It also lists sudden hearing loss or tinnitus, or ringing in the ears. Why does a blood vessel drug affect your eyes and ears?
The sensory disturbances are complex. The visual alterations, specifically the blue-tinged vision, occur because sildenafil is not perfectly selective for just the PDE5 enzyme.
It hits other targets.
Yes, it has a mild inhibitory effect on an enzyme called PDE6.
PDE6.
And PDE6 is heavily concentrated in the retina. It is crucial for the phototransduction cascade,
Which is how the eye processes light.
the process by which the eye converts light into electrical signals for the brain.
So the drug is cross-reacting with the retinal enzymes, temporarily altering how the eye processes visual data, hence the blue tint.
Exactly.
But the more severe warnings regarding sudden vision or hearing loss, the total loss, that has to be a different mechanism.
It is. They are less common but far more critical. They are often linked to sudden, localized ischemic events.
A lack of blood flow again.
Yes. The tiny, delicate blood vessels supplying the optic nerve or the auditory structures in the inner ear may experience a sudden drop in perfusion due to the systemic blood pressure changes,
They just lose their blood supply completely.
leading to immediate, sometimes permanent sensory damage.
Wow. And the final severe adverse reaction, detailed in the database, is probably the most famous one. Priapism, defined as a prolonged erection lasting longer than 4 hours.
Yes.
The text heavily emphasizes that this is a medical emergency capable of causing permanent tissue damage. To understand the severity of this warning, we need to look at the anatomy of this prolonged hydraulic event. What is actually happening during priapism?
Priapism is the catastrophic failure of the body's ability to clear the accumulated blood from the penile tissue.
The off switch is permanently broken.
If the PDE5 enzyme is completely neutralized, or if the local metabolic pathways just fail to degrade the cGMP for some reason, the smooth muscles absolutely refuse to contract.
They stay wide open.
And the blood remains trapped within the corpora cavernosa.
The vascular floodgates are locked open, but the outflow is completely blocked. It's a traffic jam.
It acts very similarly to a compartment syndrome. As the blood sits stagnant in those tissues hour after hour, it becomes progressively deoxygenated.
Because it's not circulating.
Right. The local cellular metabolism consumes whatever available oxygen is left, and the blood turns increasingly acidic.
Acidic blood trapped in delicate tissue.
Yes. This hypoxic acidic environment is incredibly toxic to the endothelial cells and the smooth muscle tissue.
If the tissue is starved of oxygen for over 4 hours, it literally begins to die.
The ischemia leads to cellular necrosis cell death and the formation of fibrotic scar tissue.
Scar tissue doesn't expand.
Exactly. If normal circulation is not rapidly restored through emergency medical intervention, which often requires the physical aspiration of the stagnant blood with a needle, or the injection of vasoconstrictive agents directly into the tissue, if that isn't done, the resulting scar tissue permanently destroys the expansion capability of the corpora cavernosa.
Meaning the patient is left with irreversible, untreatable erectile dysfunction.
It is the most severe mechanical consequence of the drug's mechanism of action.
The cure becomes the permanent cause.
Exactly.
The absolute severity of these physiological risks clarifies why the iMedix database includes such stringent guidelines regarding which demographic groups can safely interact with the medication.
The special groups.
Right. The profile designates Eriacta as unsafe for women, with specific contraindications for pregnancy and breastfeeding.
Due to a total lack of comprehensive safety data regarding fetal development and drug transfer through breast milk.
It is also strictly contraindicated for pediatric populations under the age of 18. You just don't give this to kids.
No, but the database does note that elderly populations can be prescribed the medication.
But it mandates careful clinical monitoring.
Mm-hmm.
Why are the elderly more at risk?
As the body ages, renal clearance rates, kidney function decline, and hepatic metabolism, liver function slows down.
The body's filters get older.
Right. An elderly patient is far more likely to experience a prolonged half-life of the drug.
It stays in their system longer.
Making them hypersensitive to the systemic side effects and the potential for that toxic accumulation we discussed regarding the CYP3A4 pathway.
And what about diabetics? Because the text makes an interesting note regarding diabetic patients, stating that Eriacta can be used safely, but under strict medical supervision.
Diabetes is a massive systemic disease. Over time, it heavily damages the vascular endothelium and the peripheral nervous system.
It destroys the exact infrastructure needed for an erection.
Exactly. Because it attacks that very vascular infrastructure, ED is a highly prevalent complication of diabetes.
So they need the drug more than anyone.
Right.
Permitting its use under supervision acknowledges that sildenafil is often the frontline symptomatic treatment for this specific diabetic complication, despite the inherent cardiovascular complexities of treating a diabetic patient who likely has other heart issues.
It's a calculated risk. The platform also extends its safety warnings to mundane daily activities. It cautions users against driving or operating heavy machinery after administration.
Which seems extreme to some people, but it's very necessary.
It's a direct consequence of the potential for sudden hypotensive events, right? A rapid drop in blood pressure causing dizziness or fainting, coupled with the risk of those sudden visual disturbances or the blue color tinting.
Operating a vehicle while experiencing a systemic blood pressure drop or an altered visual field is an unacceptable risk profile.
You could crash.
It highlights that the medication demands a degree of environmental control and awareness from the patient. You can't just take it and go about your day normally. We've covered the side effects, but moving from potential side effects to guaranteed dangers, we enter the danger zone. The absolute contraindications and the severe drug-drug interactions.
Yes, it's critical.
These are the scenarios where introducing Eriacta into your system moves from a managed risk to an active medical crisis.
Mm-hmm.
And the absolute highest tier warning in the text, the big red flag, is the interaction with nitrate medications.
The nitrate interaction is the defining pharmacological danger of PDE5 inhibitors.
Period.
Yes. Nitrates, such as nitroglycerin, isosorbide dinitrate, or isosorbide mononitrate. These are foundational treatments for patients with coronary artery disease and angina.
heart patients.
Right. And their mechanism of action relies on the massive, rapid release of nitric oxide directly into the bloodstream.
Wait, nitric oxide. We established earlier that nitric oxide is the initial trigger that creates the cGMP, which relaxes the blood vessel.
Yes. Nitrates flood the system with the precursor signal. They artificially drive up the production of cGMP to force the coronary arteries to dilate and deliver oxygen to the struggling heart muscle.
Okay, so if a patient takes a nitrate to flood their system with cGMP, and then takes Eriacta to completely block the enzyme that breaks down the cGMP.
You see the problem.
They are trapping their entire cardiovascular system in a state of maximum uninhibited vasodilation.
It creates an exponential compounding effect.
Wow.
The smooth muscles in the vascular walls relax entirely everywhere, and the systemic vascular resistance plummets to near zero.
The pipes all blow wide open at once.
The result is profound refractory hypotension. The blood pressure drops so rapidly and so severely that the heart simply cannot generate enough pressure to pump blood against gravity up to the brain.
Or maintain perfusion to the major organs. It induces a state of circulatory shock.
It is a potentially fatal hypertensive crisis.
Fatal.
Yes. Furthermore, it is exceptionally difficult for emergency medical personnel to reverse.
Because the drug is still actively blocking the off switch.
Exactly. The standard vasopressor medications they use to raise blood pressure in an ER often struggle to overcome the complete chemical blockade of the PDE5 and that massive influx of nitric oxide.
It's fighting a losing battle.
The combination is absolutely contraindicated under any clinical circumstances. Never mix them.
But the database lists several other significant interactions that, while perhaps not as immediately fatal as nitrates, still require severe clinical intervention. Alpha blockers, for example, frequently prescribed for hypertension or prostate issues.
They also lower blood pressure by relaxing vascular tone.
So combining them with Eriacta creates an additive hypotensive effect.
Right, leading to extreme dizziness, orthostatic hypotension, where you stand up and pass out, and potential fainting.
We also see the iMedix platform returning to the concept of liver metabolism when warning about specific antifungals, like ketoconazole, and antibiotics, like erythromycin.
Just like the furanocoumarins in grapefruit juice we talked about.
They do the same thing.
Yes, these medications are potent inhibitors of the CYP3A4 enzyme in the liver.
They shut down the exit door, causing the sildenafil to accumulate to toxic levels.
Exactly. And the database highlights an extreme version of this pharmacokinetic trap with HIV protease inhibitors.
Specifically citing ritonavir.
Ritonavir is one of the most powerful CYP3/4 inhibitors currently utilized in modern medicine.
So it locks the exit door tight.
Its inhibitory effect is so profound that if a patient on ritonavir takes a standard dose of sildenafil, the resulting blood plasma concentration of the PDE5 inhibitor can spike to incredibly dangerous levels.
It increases the half-life exponentially,
almost guaranteeing severe systemic toxicity.
The drug remains trapped in the system, continuously forcing vasodilation for hours or even days beyond its intended window.
It's a very dangerous interaction that requires extreme dose adjustments if they must be used together.
The text also extends its interaction warnings beyond the pharmacy counter. It explicitly notes the danger of combining the medication with recreational drugs, specifically poppers.
Poppers are inhaled alkyl nitrites, primarily amyl nitrite.
Nitrite, as in related to the heart medication nitrates.
Exactly. Because they share the fundamental nitrite chemistry with prescription medications like nitroglycerin, they trigger the exact same massive release of nitric oxide.
So inhaling a recreational nitrite at a club, while sildenafil is actively blocking the PDE5 enzyme, creates the exact identical fatal hypotensive crisis we just analyzed with the heart medication.
The chemical interaction does not differentiate between a prescription pad and a recreational setting.
The body doesn't know why the chemical is there, it just reacts.
The chemistry is absolute. The profound drop in blood pressure and subsequent cardiovascular collapse is a guaranteed physiological response to mixing those specific molecules.
So what does this all mean? This exhaustive analysis of the severe interactions and systemic risks brings us back to the jarring regulatory reality we introduced at the very beginning of the deep dive.
The not approved status.
Yes. The iMedix database flags Eriacta as not approved. When we review the broader structural context of the iMedix platform as detailed in the source material, we see FDA-approved medications like Rybelsus for diabetes or daclucan for fungal infections marked with a verifying green checkmark.
That green checkmark represents a massive, multi-tiered infrastructure of regulatory oversight.
It's the gold standard.
It signifies that the manufacturing facilities are regularly inspected, the chemical composition of the active pharmaceutical ingredient is continuously tested for purity, and the dosage strength is guaranteed to be exact in every single pill off the assembly line.
You know exactly what you're putting in your body. But Eriacta sits on a completely separate list of non-approved generics, marked with a red X.
Alongside other unapproved formulations like kamagra, Fidelista, Fildena, and Suhagra.
The red X indicates the total absence of that regulatory safety net.
These specific generic formulations are often manufactured in facilities entirely outside the jurisdiction of strict regulatory bodies like the FDA or the EMA.
So while the theoretical active ingredient, sildenafil citrate, is a known quantity, we know how it works, the actual end product reaching the consumer via gray market channels is entirely unverified.
And this regulatory vacuum is what fuels the massive health concern highlighted in the final sections of the iMedix text, the counterfeit risk.
The gray market.
The database warns that because Eriacta is widely and anonymously available through online vendors, the prevalence of counterfeit and adulterated versions is a staggering threat to patient safety.
When a patient purchases an unapproved medication from an unlicensed online pharmacy, they are actively removing themselves from the protected pharmaceutical supply chain.
The source text outlines the grim reality of these counterfeit operations. The pills may contain completely incorrect dosages,
Which, based on what we've learned about toxic accumulation, is terrifying.
perhaps a massive toxic overdose of sildenafil, or perhaps microdoses that render the drug entirely ineffective. You just don't know.
The dosage variation is dangerous enough. But the text goes further, warning that counterfeit pills frequently contain highly toxic substitute ingredients.
Forensic analysis of gray market ED medications is alarming. It routinely reveals the presence of heavy metals, commercial paint used for color matching the pills.
Paint.
Yes, printer ink, and dangerous industrial binding agents.
That is insane.
Furthermore, the pills are frequently cross-contaminated with other potent, unlisted, active pharmaceutical ingredients depending on whatever else that unregulated lab is manufacturing that day.
So a patient could ingest a pill, assuming it is a standard PDE5 inhibitor, and inadvertently consume a dangerous cocktail of unknown chemical agents.
The consequences range from unexpected severe allergic reactions to acute hepatotoxicity, total liver failure, induced by the heavy metals or industrial solvents.
The tragic irony of the gray market is that patients often utilize it to find an affordable, discreet solution to a deeply personal medical issue like ED.
But in bypassing the regulated system, they expose themselves to catastrophic, life-altering physiological risks. Treatment failure is the best-case scenario with the counterfeit pill. Organ failure is a very real possibility.
And the iMedix platform explicitly exists to map these specific dangers. By cataloging the unapproved generics and outlining the severe counterfeit risks alongside the complex pharmacological profiles, the database attempts to force the user to confront the reality of their purchasing decisions.
Information is really the only mechanism to combat the inherent dangers of an unregulated market.
If a patient fundamentally understands the systemic cardiovascular impact of a PDE5 inhibitor and the lethal nature of its drug interactions, they are theoretically much less likely to trust a counterfeit version formulated with unknown industrial agents.
At least that's the hope.
Right. But to understand how successful this information transfer actually is, we can examine the user reviews curated by the iMedix database. Let's look at the human element.
The source material provides two specific interactions from the Eriacta page that offer a really stark view of patient behavior and medical literacy.
The user reviews are perhaps the most vital piece of the database when assessing real-world outcomes. They demonstrate the operational gap between a clinical directive and a patient's execution of that directive.
How people actually act in their own homes.
Exactly. The first review is from a user named Zach in 2019 who left a very straightforward comment. He just wrote, "Thank you for this information."
Which represents the ideal interaction with the platform.
A user accessing the data, presumably absorbing the safety parameters, and utilizing the resource as a tool for informed decision-making.
It is the intended function of the database functioning perfectly. The information is presented, received, and hopefully applied to mitigate risk.
The system works. But the second review reveals the chaotic reality of how patients actually consume medication.
GymRat77.
Yes, a user posting under GymRat77 in September 2024 wrote, "I don't know, maybe it's just me, but the under-the-tongue thing didn't work as well as I expected. Yeah, it worked, but I was hoping for something that lasted longer. Might try something else next time.
This raises an important question about patient literacy and behavior. The GymRat 77 review is a masterclass in unintentional pharmacological sabotage.
Sabotage. Let's dissect this.
If we cross-reference his complaint with the rigorous clinical data we just analyzed, the failure of the medication is entirely the result of massive administration errors on his part.
The most glaring issue being his reference to the under-the-tongue thing.
He attempted to administer the drug sublingually.
But the official iMedix instructions under the dosage and administration section are totally unambiguous. They dictate that the tablet must be swallowed whole with a full glass of water and explicitly command the user to do not crush or chew.
The distinction between oral administration and sublingual administration is not merely a preference. It completely alters the pharmacokinetics of the drug.
You can't just choose how a pill enters your body.
No. A standard oral tablet is engineered with a specific matrix of inactive ingredients designed to survive the highly acidic environment of the stomach, pass through the pyloric sphincter, and dissolve optimally within the specific pH of the small intestine for absorption into the portal vein.
The entire pill is built for a gastrointestinal journey. It's a vehicle.
By placing that specifically engineered tablet under the tongue, the user is attempting to force the drug to absorb through the oral mucosa directly into the superior vena cava, bypassing the gastrointestinal tract and first-pass hepatic metabolism entirely.
He's trying a shortcut. But because the tablet isn't formulated as a sublingual film or a rapidly dissolving matrix, it doesn't break down effectively in the saliva.
Precisely. The tablet likely just sat under his tongue, slowly eroding, resulting in erratic, highly inefficient absorption.
Only a fraction of the active ingredient likely entered the bloodstream, completely disrupting the intended peak plasma concentration.
It is absolutely expected that he concluded it didn't work as well as expected. He circumvented the specific delivery mechanism the molecule requires to reach systemic efficacy.
He treated a highly engineered cardiovascular medication, like a breath mint, based on an assumption or a misinterpretation of how drugs enter the body.
The second component of his review further highlights the literacy gap. He notes he was hoping for something that lasted longer.
This directly contradicts the foundational biological limitations of the drug we discussed earlier.
The 4 to 6 hour window.
The database explicitly outlines that 4 to 6 hour therapeutic window dictated by the terminal half-life of sildenafil citrate.
Hoping the medication lasts longer will not magically alter the rate at which the CYP3A4 enzymes in the liver metabolize and excrete the compound.
He is expressing dissatisfaction with the drug for failing to achieve an outcome that is physiologically impossible based on its mechanism of action.
The GymRat 77 review perfectly encapsulates the necessity of deep, comprehensive medical resources like iMedix.
If a patient is procuring an unapproved generic medication from a gray market source, they are highly unlikely to receive a consultation with a pharmacist regarding the nuances of gastrointestinal absorption or enzymatic half-lives.
They are operating in a total information void.
And when patients guess how to administer complex systemic vasodilators, the outcomes will inherently range from frustrating clinical failure, as seen with GymRat 77,
to potentially catastrophic medical emergencies if they happen to guess incorrectly regarding interactions with grapefruit juice, high-fat meals, or nitrate medications.
It forces us to confront our own habits as consumers of healthcare. We frequently view medications as simple commodities, skimming the instructions and relying on assumptions regarding their mechanics.
The entire Eriacta profile demonstrates that there is no room for passive consumption when dealing with potent pharmacological agents capable of altering systemic blood pressure and overriding local enzymatic pathways.
Synthesizing all the data from this iMedix deep dive reveals a complex, multi-layered narrative. Sildenafil citrate is an undeniably powerful, elegantly targeted pharmacological tool that manipulates the body's natural hydraulic systems.
However, its generic iterations, like Eriacta, exist on a dangerous precipice between global accessibility and severe systemic risk.
The drug profile is a minefield of potential complications, from the fatal compounding hypotensive crisis triggered by nitrates to the unpredictable absorption rates caused by everyday dietary choices.
And layering the not-approved regulatory status over that complex pharmacological profile introduces the wild, unregulated variables of the gray market and counterfeit toxicity, shifting the burden of safety entirely onto the informed patient.
This comprehensive deconstruction was made possible by the educational resources provided by the iMedix platform, Independent databases serve as the critical infrastructure necessary to translate dense clinical pharmacokinetics into actionable intelligence for patient safety.
They are the essential counterweight to the information void of the unregulated internet market. Transparency and comprehensive education are the only effective defenses against the inherent risks of navigating modern pharmacology.
Before we conclude, consider the broader implications of the data we've reviewed today. The sustained, massive global demand for unapproved gray market generics like Eriacta is a profound commentary on the state of global healthcare. If millions of patients are continuously willing to navigate the shadows of unregulated internet pharmacies, risking exposure to toxic counterfeit pills and fatal unmonitored drug interactions simply to treat a common vascular condition, it indicates a structural failure. It suggests a hidden crisis in our medical ecosystem, one that is struggling to reconcile the high cost of regulated care, the deep societal stigma surrounding certain medical conditions, and the fundamental patient need for accessible solutions. The gray market thrives in the exact spaces where the regulated system fails to provide viable, affordable access. Thank you for joining us on this deep dive into the source material. Always verify your sources, understand the mechanics of your decisions, and stay intensely curious.